Hello, global residents and colleagues around the world. This is your host for tonight, Tung from the American Society of Plastic Surgeons International Resident Forum podcast team. This podcast is an official platform directly organized and supported by the American Society of Plastic Surgeons, created to spotlight global voices in plastic surgery. It is a place where we share your life stories, your professional journeys, and the issues, challenges, and concerns you believe deserve to be heard in our global community. If you're interested in sharing your story or perspective, please feel free to reach out to us at aspsirfpodcastteam@gmail.com. Today, we are honored to welcome Nada Al-Hadithy. Nada's interests extend far beyond aesthetic surgery. She is deeply engaged in women's issues in plastic surgery, humanitarian medicine, and the intersection between surgery ethics and humanities. Most importantly, Nada has just returned from Gaza, where she worked on the front line as a humanitarian physician. Today, she will share with us an unfiltered first-hand perspective of what it truly means to practice medicine under extreme conditions.
Hi, thank you very much for having me on the podcast. I'm delighted to be here and lovely chatting to you too, especially after my time in Taiwan. So my background is I went into surgery because of my mentor, who is a lady called Sui Chai Ung. She was the first female orthopedic consultant in London. And she's Singaporean, and my mom's Singaporean, so I've come from a diverse background. And she told me about her work out in Lebanon and various conflict zones. And it really inspired me to pursue a career in medicine. And so I went to University College London. I got a run through number in plastic surgery training in the UK and started in Scotland, and then sort of worked around numerous units in the country. And I also took various career breaks to do a medical doctorate, to do some leadership fellowship at the Department of Health and Social Care, working at sort of the top level in the civil service in the UK, and
Wow. Mm.
worked with an organization called Medicine Africa, where we partnered with King's Global Health Partnership to deliver training in a sustainable fashion to some of the most fragile states in the world. So places like Somaliland, Rwanda, and Kenya, as well as Gaza and Syria and Lebanon. And then subsequent to that, I carried on with my training in Oxford. And when I finished my hand fellowship in Oxford, I was fortunate enough to spend some time in Taiwan at Ida Hospital with Professor Tung and Dr. Shi and the amazing team there,
Right.
which was just such a wonderful experience. I cannot encourage you all enough to go and spend some time in Taiwan. It's just such a brilliant place. And the people, especially, are so kind and so good. I just loved my whole time there. And then after that, I did my Burns Fellowship in Middlemore Hospital in New Zealand, which is the team that managed the White Island disaster. So that was a pretty big deal in the Burns community, where a volcano exploded with tourists on it. So you can imagine the scale and ferocity of the burns there. And then after that, I spent a bit of time in Japan with the father of supermicro surgery, Professor Kashima, of course. So yeah, I spent some time with him, which was incredible, and then returned back to the UK, where I now work as a consultant in burns and hands and skin cancer at Stoke Mandeville Hospital, which is part of the Bucks NHS Healthcare Trust. And I tally that with being a member on the registry for UK Med, which is one of the organisations that supplies the emergency medical team, the EMT, for the UK government. And I also go out with other organisations to conflict zones to help with reconstruction, limb salvage, and burn surgery. So, as you mentioned, my most recent trip was in July. To Gaza, where I was working out of Nasser Hospital for 3 weeks, which was, as you mentioned, pretty intense.
Yeah, wow, you were really everywhere. I guess we can come back to talk a little more about like what inspired you to be on this path for this humanitarian path.
Yeah, so I guess I'm not sure if it's the case everywhere in the world, but I feel that in the UK, certainly, most people that go into medicine want to do it because they want to make a positive impact in their local communities and want to try and help with technical and clinical skills. And coming from a diverse background, I saw myself as a sort of citizen of the globe. And my father is Iraqi, my mother's Singaporean. We lived abroad a lot growing up, and I always was shocked and horrified by the health inequalities that we see, around the world, but also within my local, within the UK. And it just made me really want to lean into difficult environments and try to contribute in any positive way I could.
Can you give us some like names of the associations you were affiliated with while you were part of all these experiences?
Yeah, so training as a surgeon in the UK, you're not really allowed ethically to go out and operate abroad. And I think that's right. So during my training, I wasn't an independent surgeon traveling abroad and working, because obviously I wasn't an independent surgeon back at home. And that diktat has now been reinforced through the WHO off the back of the Haiti disaster, when too many wannabe humanitarians went out without the necessary skill set, and probably did more harm than good. And there are lots of people that did a lot of really good stuff, but there was some practice there that shouldn't have really happened. And as a result of that, the WHO's set up a national, worldwide diktat that people that go out into humanitarian or conflict zones should be, appropriately trained and supported by the correct organizations that understand how to facilitate this kind of work. And so that's called an EMT. And through my training, I wasn't affiliated with an EMT because I wasn't a consultant yet. So the majority of my work I did was in education. And I have a diploma in health education, and I was on the online lead for the FRCS program with the BFIRST, which is our British Association of Plastic Surgeons here in the UK,
Mm-hmm.
and MAP, which is Medical Aid for Palestinians, to do long-term training remotely. And that was then coupled with visits on site to do the technical training with, experts from around the world. And I was helping facilitate that longitudinally. And that was my most recent role in teaching and training. And prior
Oh,
to that,
okay. Mm.
sorry, go ahead.
Oh, no, no, keep going. Sorry.
And the idea of that was to get, because there'd been a siege in Gaza for sort of 19 years, local surgeons can't get out to get trained, and there weren't really enough plastic surgeons within Gaza to be able to do the necessary training to bring on the next generation of plastic surgeons. And so 18 local surgeons were selected with the local faculty, and then we partnered with them to help deliver their training needs, and hopefully get them sort of FRCS or board level equivalents. Unfortunately, the war broke out, and three of my delegates have been killed. So, that's still not back on its feet yet, but we're hoping to continue the training program. And I'm in communication with, the faculty locally to try and support that. And before that, it was with Medicine Africa, who had an online platform. And this was back in 2010. I was the COO with them, and we worked very closely with the King's College London Global Health Partnership, which is a really big global health network based out of London. And we had a relationship with three main countries. So Somaliland was one of the big ones, Kenya, and Rwanda, and we supported them through various online training programs with face-to-face remote teaching. And then that was partnered again with the visits in to get their local faculty up to speed to be able to be trainers themselves. And I think by the time I left, we delivered 100,000 hours of teaching, which was almost the entirety of the undergraduate medical curriculum. So it was a great team to be part of. And I worked very closely with a chap called Alexander Finlayson, who's a doctor here based in Oxford. And the wider team as well were all really committed individuals who gave up their time and their expertise to try and help develop the next generation of clinicians in places where they don't have the same degree of security as we do.
Wow. I'm wondering like what is your family's support and view on this since it feels like it will require an immense amount of dedication from your time.
Yeah, I mean, as we all know, being a surgeon is demanding, and my husband's been incredibly supportive. I've got three young children, and before I had kids, I definitely spent more time doing a lot more of this. But now that they're a little bit older, going out to Gaza, for example, was a debate that I had with my family and my husband, for quite a long time before we made the decision that I should go. Um, they were just so desperate for plastic surgeons, and there's so much need that I just felt compelled to go and help. And especially as a mother, like the number of children, Gaza's got the highest amputees in the world and child amputees anywhere in the world in the history of the world ever now. And if you're able to save one limb, if you're able to reconstruct one limb, that's still the world to that one patient. And so, plastic surgeons are, as you know, able to help salvage limbs. If there's a traumatic fracture and the wound is open, the metalwork is open, ultimately that limb will be amputated. But if you're able to put a flap on it, or if you're able to get coverage and the metalwork is covered and the bone is allowed to unite, then it's possible that you can save that limb. And that's certainly what we spent most of our time doing while we were in Gaza. And I would say 75% of my patients were children.
Wow. Can you give us like some impact how you really shows an impact that you can change these situations like how there's so much needs for plastic surgeons but the qualification seems like still a difficulties because what you mentioned before is that the surgeons are undertrained. So do you have a plan for or a vision of how to overcome that difficulties?
Yeah, I mean, with regards to Gaza, it's a very complex situation with huge need, and the whole place has been completely demolished. So the entire strip has to be completely rebuilt, and every single hospital has been targeted and blown up. So there's really, really
Wow.
significant need, both in terms of the medical equipment, the facilities, the resources, but more than anything, the human capital has been totally destroyed. Gaza's had the highest number of doctors killed in any conflict in the world ever. And there's been a real loss because, as you know, it takes 15, 20 years to train a doctor. Um, and you can't you can't regenerate that overnight. It's not like a building that you can rebuild. It's the knowledge, the expertise, and oftentimes these doctors are the pillars of their communities. They're the people that people go to when they need help. They're the ones that are able to advocate for their patients. They're the ones that are able to get medical attention in and get medical supplies in. And without that leadership, there's been a significant impact. And certainly, whenever I was finding things challenging in Gaza, I would look to my local Palestinian doctors and take inspiration from them because they are amazing.
Right, but what you have mentioned is like I think a great interesting issue to be addressed. Like it takes 10 to 20 years to train a great doctor like someone like you, and but then you see the needs for the Gaza Strip and the needs for plastic surgeons, and you also mentioned it is the place where the highest number of doctors being killed. Like, I mean, I'm wondering what goes on in your emotions and your mind, especially you have three children in your family. Like, is it like a balance? Is it like a gamble every trip you take to there, or or you just feel like it's not gonna happen to you?
Well, anything can happen to anyone, and I don't for one second think that I'm above risk and danger. But the figures still aren't confirmed. But the Lancet figures are that about 200,000 Palestinians have been killed, and about 60 to 80% of them are children, and we still don't know the exact figures there either. Um, and only seven, I think, internationals have been killed. So it's
Oh,
not
okay.
it's the risk to me is certainly lower than to risk to
Right.
local Palestinians. And, you know, when you are there as an international, you're in a deconflicted zone. So, for example, COGAT, which is the organization from Israel that manages internationals within the Gaza Strip, would be aware that I was in there because they've given me the permit to enter. And they would be aware that, you know, Nasser Hospital, when I was there, had 36 international doctors in there. And, you know, it's very much a closed environment. So they had very little media scrutiny, for example, because they wouldn't allow any media or forensic pathologists in. But, you know, I obviously was in communication with my friends and family. And, you know, certainly at one point there were rockets and snipers shooting into the hospital complex. And I contacted my friends and family in the UK who escalated it to the British government and spoke to the Israeli ambassador. So, you know, I have that extra degree of protection that the local Gazans don't. And it shouldn't be like that. You know, the local Gazans, the civilians, should be able to have the same international laws applied to them that apply to us in conflict, but they don't, and we do. And so we could utilize that. Um, After we left, the day we left, Israel attacked the WHO warehouse, which supplied all of the medical supplies for about for the WHO, and demolished it. And three of the WHO workers were on my convoy exiting, and they were telling stories of bullets shooting past them, and one of their colleagues got abducted. So, you know, it's a real threat. It definitely is a real threat. And these people that were talking to me were French and internationals, and they felt very much in fear of their lives. So it's not that it's without risk, but as I say, I just felt I'd watched what had been going on for, you know, nearly 2 years, and I just felt like I had to do something. Um, and yeah, being a mother and seeing my children who are so precious, and recognizing so many children in Gaza that had been severely injured and having very limited ability to limb salvage or burns care, made me want to go out even more.
Wow, wow, that's definitely the most frontline stories I've ever heard. Wow. Thank you for sharing that part. So I'm wondering, like, besides doing all this burns and salvage limb practice work in the Gaza that you can do as a plastic surgeon, when you come back to where you are located at, is there something that you felt like you can push to move, or like a policy, or you know something to change that you can use this bring back experience to reshape your community?
Yeah, that's a really, really interesting point. So Nigel Crisp wrote a book called Turning the World Upside Down, and he's done a huge amount of work in, you know, the South and in different parts of the world. And there's so much that we can learn from our colleagues and peers across the world. And it doesn't have to be advanced technology. It can be principles. It can be ways of developing a service. It can be using community holistically. And that's certainly something that's happening quite a lot now in the UK. So when I was in Gaza, there was maybe two nurses on the ward to care for 50, 60 patients. And there was no way that they would be able to put up every bag of fluid or deliver every medication required. And the families are the ones that did it. So we taught the families how to do a fluid balance chart, how to monitor the urine output, how to monitor the fluid input, and to ensure that we were in balance and achieving resuscitation for our burns patients, for example. Because without those family members by that child's side, it would not have been possible for the child to be adequately resuscitated, because there were so many hundreds of patients coming in every single day. And oftentimes these aren't immediate family members, because the immediate family had all been killed. So two of my boys, Osama and um, Khalid, had 40% burns, and four of their siblings and both their parents had been killed in the same bomb that blew up their tent. And it was their aunt who sat by, you know, their bedside and administered all the cares that were required. And this is the thing about learning from other communities. There's different ways of practicing, which, you know, we get very comfortable in what's familiar to us in the world we exist in. And if you go and see other cultures and other places, your eyes are open to different things that often can be better. And certainly I learned that when I was in Taiwan. I mean, there's so much
Yeah.
good stuff happening in Taiwan. I remember I needed to get my blood taken for my next fellowship in New Zealand. And I
Right.
registered in the hospital. I got seen by the doctor and I got my bloods taken. This is as a foreign national, not as a local Taiwanese, all in the same day. And I think I spent £50. And I said to one of the doctors who was like in the waiting room with me when I was waiting to get my blood taken, I was like, I cannot believe how good this is. And he was like, yeah, Taiwan's famous for it. We've got very good and very cheap healthcare. And it's just like, and I'm like, and fast. I've got it all done on the same day.
Yeah, it's
So
fast and cheap, like the
yeah,
McDonald's.
fast and cheap, but good as well, like super good. So I was just like, there's so much that we can learn by being abroad. I mean, the orthopedic center. So the plastic surgery theatre in Nasa Hospital was right next to the orthopedic theatre, and these guys would routinely do 30 operations a day. I mean, they were working non-stop until 1, 2 in the morning every single day, and often through the night, and they would be working in shifts between themselves. And they would put in an X fix on an arm in about 10 minutes. Like they were so skilled and so good. And they were so kind, like they were just really lovely humans. And certainly when I was doing plastics cases, like we did a peroneus brevis flap to salvage an ankle, we did 2 free flaps, an LD and a TFL, because the ALT we were raising had shrapnel like too close to the pedicle, so we just converted it to a TFL. We did multiple burns excisions, and a lot of the nurses unfortunately had been killed, and so we were having nursing support from the midwifery section, and midwives aren't trained to be theatre nurses, and it was a case of kind of talking to them and understanding what kind of setup they're used to and figuring out what the best way to work was. But the thing that came to me more than anything was how adaptable everyone was. Everyone was committed to helping their community and doing whatever it took to get the job done to look after their patients. And that was amazing to me, like especially in the UK, where a lot of the time it's a computer says no situation. You try to do something or change something and it's like, well, the template is set up like this, and I'm like, okay. so so it was pretty incredible just to see how readily everyone had to adapt and would adapt and make the most of it.
Right. Like you've mentioned so many great stories, and it seems like I'm sure there were definitely many challenges you face, especially at the front line. I'm sure the moment where I'm sure definitely a moment where you feel like this patient could be safe, but like at that critical situation, something was just lacking. Like, could you tell us a defining moment in your career path that you really experienced difficulties that you really felt, was there a moment you felt emotional exhausted that you just couldn't get through it, and how did you break through that moment, especially pursuing this very challenging and unique path?
Yeah, so um I guess I've had quite a few challenges in my career, and I think some of it might be due to the intersectionality of gender and race. I'm a woman and I'm a mother. I've had 3 children, and I'm also an ethnic minority. And I think the
Hmm.
time for me when I really couldn't cope anymore was when I felt that my career was impacting my children. And it was Kimberly Crenshaw in 1989 who sort of describes, and she was a legal scholar who essentially coined the term and described that, you know, you can have various forms of discrimination, particularly those based on gender and race, which overlap and create a unique experience of disadvantage. Um, and so, for example, I'd kind of done things during my pregnancy which I think in any other work environment would not be acceptable. And, there are laws to protect women from exposing their unborn babies to harm. And I ultimately lost my first baby, and that led to a whole number of health problems for me, which meant that by the time I had my third child, I had an out of hospital uterine rupture, which meant
Oh,
that
wow.
she was 27 weeks and 5 days, and I was in ICU. She was in ICU. Um, and we didn't know for sure she was going to make it for the first 10 days of her life.
Wow.
And I just felt like I'd sacrificed too much for my career. I just felt like if I hadn't been doing the things that I was kind of encouraged, as a euphemism to do, I wouldn't have been in that position. Um, and it's a unique thing for women to experience because men don't carry babies and men don't feel um,
Right.
that that sort of urgent need, in my case, to breastfeed. To lots of women do choose to breastfeed, lots of women don't choose to breastfeed, and that's completely up to them. But I was committed to breastfeeding, and so I wanted to be there for my children when they were young so that I could make sure they had all the nutrients and the goodness that they needed. And the consequences on my career from that were significant. And it's this kind of thing which made me feel like surgery isn't the right place to be. But that's again another reason why doing work abroad can really help give you clarity of mind and reduce the framework that you're stuck in and break it down into its component parts. So, for example, these situations I found myself in the UK just wouldn't have transpired in other parts in the world, or other people's creativity when it comes to managing family and work life and getting that balance right is different in other places in the world. So, for example, in certain Scandinavian countries, everyone works less than full time. And that's just normal. And the whole service is set up to it so that you can have a parent drop off their kid, but not miss pickup as well. You know what I mean? So there's things like that that can be changed, but they just
Right.
aren't. And it started making me query whether we really need to have a culture of presenteeism. Like, you can be really committed and you can work really hard, but you can do it in your own timeframes. And that's why, again, the teaching and the sort of global health work was a saving grace for me. It just gave me another lens to look through that made me realize that things back at home, even though they're troublesome, aren't the only way.
I'm very, very curious about how your husband's perspective on this.
You need to
You
speak to
know.
him, I think. I mean, it's definitely been challenging for him. When we
Because
got
does
together.
like he either support or it's I think it's a very, very difficult dilemma for him as well, like for to either support or to like since you what you have described what happened to your firstborn. I think his attitude must be very mixed.
Yeah, I mean, my husband has a big job as well. He's a co-founder of an environmental sustainability company, and he does really good work, really important work. But he's also a lot more flexible because it's his company, and obviously, if you're office based, you can work from home sometimes and things like that. So he's been incredibly supportive, and he's been able to flex to back up the childcare and things like that, for sure. And he's a great husband and a great dad, and it's definitely been a partnership. We've had to learn how to navigate all of this. It's not been easy. When we first got together, I said, I'm a surgeon, and most men would run away screaming, I think, but he he didn't. And I think he thought he knew what it would mean, but I don't think he really fully appreciated it until a bit later. But, you know, he's proud, I think. He tells me he's proud of me. And, even on New Year's Eve, when we were sitting and reflecting on our year just gone by, he said, for sure, the biggest thing of 25 was you going to Gaza. And, he said how immensely proud he was. And, I was immensely grateful to him because
Wow.
I wouldn't have been able to go if he hadn't supported me to look after the children. Like, I would not
Yeah.
have left if I didn't know there was an amazing father there looking after my children, right? Um, so it's definitely a partnership.
Yeah, that's a huge applause for him. Like really, I feel like, um, I'm not sure the percentage, but I'm sure a big percentage of the husband would just be worried and will hope you could just rather stay at home. But he really supported you on this. I'm sure it means a lot for you.
Yeah,
Yeah.
100%. 100%.
Can you also tell us a little more about how you mentioned you were big on gender issues and how your difficulties as a female surgeon in plastic surgery society? Like you also gave a talk about female surgeons in EDA hospitals about how little plastic surgeons that are females and how you were hoping that this can be a trend of more female surgeons in the society.
Yeah, I mean, women make up 50% of the population, right? And I think even 52% in the UK. If you're going to offer really excellent healthcare, you need to have diversity in the workforce. I feel that the experiences I've had as a woman, as a mother, as someone who's been a patient has significantly improved the quality of care I give because I genuinely understand how it feels. Like when my patients tell me that they've had a rough night sleeping in hospital, I know how rough it is. Like I know you don't get any sleep when you're in hospital because I've been an inpatient in hospital for weeks. So having a workforce that's reflective of your community means that you have a workforce that are able to communicate with them, that are understanding of their needs, that have parallel life experiences. And that's even more important in the leadership. So if you have a bunch of aristocratic men, traditionally in England, of course, the majority of people that would go into medicine would have come from a certain middle upper class background and they would have certain values and have certain life experiences making all the decisions about what research topics should be posed, then that actually makes a significant difference on what research is done because it's what's funded, and therefore what our body of knowledge is in medicine. So when I was at the Department of Health and Social Care, I had the great privilege of working with Chris Whitty, who's our current CMO, but he was the CSA then. And I worked with Dame Sally, who was the then Chief Medical Officer of the country. And she was in charge of the NIHR funding, which is the budget that the UK government gives to scientific research. And she said that she initiated a methodology to ensure that all of the applicants, big universities, big research experts applying for the funding were compliant with basic inclusion requirements to ensure that women had a seat at the table. And this is called the Athena Swan Charter, which means that you have a scientific academic network to ensure that people can reach their full potential and there aren't structural barriers there against them because they're women. So, for example, a lot of let's talk about business. A lot of really important conversations that would lead to promotions would happen on the golf course, and who
Okay.
gets invited to the golf course? Or, at the pub after work. Who goes to the pub after work? A lot of women are the primary caregivers. So they'll run home to be there to pick up their kids from school and to get their dinner ready. And, these kinds of important opportunities shouldn't be passing you by just because you're not out drinking with the boss late at night, for example, or on the golf course. And that was similar principles of the Athena Swan Charter. So in order for institutions to be able to apply to the NIHR, they had to demonstrate that they were ensuring that their workplace was respectful of diversity and included everyone. And that was really important because it meant that more of the topics relevant to women's health get researched. So, for example, in the UK, it takes 8 years for a woman who presents with pelvic pain to get a diagnosis of endometriosis. 8 years of suffering before that diagnosis is made. That's on average. It might be improving now. But if a man present with a symptom of prostate, you get diagnosed pretty quickly. And that's because we have a great deal of knowledge, a great deal of research behind us, and we can get that diagnosis made and we can give them the support and the care they need. So it's these kinds of things that need to be addressed in health equity. And there's still a massive imbalance. And we know that diversity in leadership leads to diversity of thought, it leads to better outcomes, it leads to higher efficiencies. And there's really nice studies from Deloitte and from Forbes that show that you're 6 more times likely to be innovative and agile if you're inclusive of cultures. You're 8 times more likely to achieve better business outcomes. So it's not just a nice thing to have, it does mean you get better results.
Can I add like just an observation like from my colleagues? Like for example, like if I have uh, a girl, a female surgeon who is pregnant, then in our hospital, the policy is that she basically cannot do overnight duty. But every one of us, we have to do like overnight duty from like 5 p.m. until the next day's 8 a.m. So basically, every day that when she's on duty, we will have to find another person to cover her duty night from midnight until 8 a.m. So basically, because of this issue, like a lot of people have been chatting about like concerns like how she's giving extra work to the colleagues. Like I'm wondering how, since there is also some physical differences between the men and women, what how do you overcome this and being able to raise it to, how what you envision?
Yeah, no, and I can take your point on that. I've got male colleagues and family members who are doctors and have made similar comments. But ultimately, a woman is only pregnant for 9 months, right? And if you think about the entirety of your career, we go into medicine in the UK from when we kind of choose our A level results. Ultimately, you're like, I must do chemistry, biology, maths, and English or whatever to get the degree I need to get into medical school. So it's from 16 or even younger in some cases, people commit to that career. And in England, you'll often work until you're 76. All right. So you've committed 60 years of your life to a demanding and committed vocation. Like it doesn't just finish at 5 o'clock or 6 o'clock when you walk out of the hospital door. This is something that you're doing and thinking about a
Right.
lot of your life,
Mm.
right? So, of that 60 years, for your colleagues to cover for that 9 months or whatever number of months it is, because in the UK, it's not the entire 9 month pregnancy, it's actually, there's a big issue with it in the UK that lots of departments don't take their female trainees off on calls. And there has been data to show that if you do work erratic hours, you have intrauterine growth retardation, you're more likely to have a pregnancy loss, you're more likely to have big bleeds during the labor. Like there's significant problems with working night shifts when you're pregnant. Um, so I hope all of you can feel good that you're doing the right thing, first of all. But second of all, the hospital, from an HR perspective, should have enough slack in the system to support that pregnant trainee. Just in the way that if you broke your wrist, and I'm not
Yeah, it's the
comparing
system.
pregnancy,
Yeah.
do you know what I mean? Like, I'm not comparing pregnancy to a broken bone, but if, another male surgeon had an injury, no one would say, oh my gosh, that guy, he's
Oh,
making us
I know
work
what you
harder.
mean. Yeah.
It's like
Yeah.
he's had a thing happen to him, which we need to support him until we get him through this. Like we're all members of a team, and pregnancy is a choice, so it's not the same as an accident. I agree. Pregnancy isn't an illness, and it's something that the HR department needs to have supportive systems in place so that the rest of you aren't doing way too much and aren't feeling completely exhausted. So maybe there should be more people available. I don't know. This is something that needs to be done at the departmental level, and I can't answer for Taiwan.
Right. Right. Well, I'm very thank you very much to Nada. You have gave the two most interesting topics I have listened so far about humanitarian and female surgeons in plastic surgery society. I just hope to address one last question that you can give back to us, to the global residents around the world, some messages to them that if you can repeat your residence, or if you can go back to your 15 years ago you, what would you tell yourself? What advice would you give yourself?
I'd probably encourage myself to find my tribe earlier. Like it wasn't until I did my leadership fellowship at the Department of Health where I met all the other um, fellows there that I really kind of recognized that there's a huge amount of diversity, and it's really worth finding your kin in medicine, or finding a mentor, someone you can really trust and talk to that has an understanding of your worldview. Because a lot of time when things were going wrong early on, I felt that the people I spoke to didn't really understand because they didn't come from that same perspective or have the willingness to see a different perspective. So yeah, find a mentor and find your tribe.
Wow. That's a really good one. That's a really good one. And I think that that really connects to why, you know, this is a platform. American Society of Plastic Surgery, the International Resident Forum, is a platform for global residents to be connected, to share the stories. Really, like the final touch that NADA gives us is to be connected to the world earlier in life, so you will be able to steer your life to the right direction where you wish to become of who you are. I really thank you tonight to NADA and to the American Society of Plastic Surgery International Resident Forum team. Thank you so much. Tonight has been a good night. Thank you for your night and attention.
Thank you very much. It's been an honor to talk to you.
We hope you enjoyed this episode of the Enhance Your Practice podcast series brought to you by ASPS University. You can listen to our other episodes on any of the podcast platforms where they are currently available, or you can download recordings directly from ASPS EdNet. New seasons and episodes coming soon on practice management. Please contact ASPS Education with your feedback and suggestions for future podcast topics. Thank you for tuning in.